There are numerous YouTubes discussing the topic of whether dental implants are painful, but the reason that you've come to this educational platform is to learn about the critical information that nobody else is sharing with you and that is vital so that you can make the correct decision with your best interest at heart. I'm an implantologist with 30 years of clinical experience, and I've placed and restored 16,000 implants. In this video, we will discuss important factors. We will quantify and qualify the amount of discomfort felt during and after implant surgery. We will consider how often swelling and bruising occurs, and we will explore in detail the secrets of how to manage post-operative discomfort, pain and swelling, and I will provide specific kinds of anesthetics that last up to 8 hours with the objective of fast-tracking healing and recovery. Our goal is to discern the truth from the media hype and present you with scientifically backed information. Your time is precious and your health is invaluable, so thank you for investing your time with us. The surgical placement of dental implants is typically performed under local anesthesia, ensuring that the procedure itself is generally painless. In essence, it is a reverse extraction, and so therefore patients who have experienced a tooth extraction, you will have a comparable experience. Now, some discomfort, such as pressure and vibrations, can be experienced during the implant surgery, but it is generally well tolerated by patients. And after the surgery, mild to moderate soreness or discomfort in the implant area is common, which can be managed with simple over-the-counter pain medications. Swelling and bruising around the implant site may occur, but it is usually temporary and will subside within a few days. And in my clinical experience, approximately 10% of patients get a little bit of post-operative swelling. Now, obviously, the level of post-operative discomfort can vary depending on the individual's pain tolerance and the complexity of the case. So by way of example, if a patient is receiving a single tooth implant versus a patient who is receiving multiple implants, bone grafts, and a sinus lift, those patients will experience some temporary post-operative discomfort. Most patients report that any discomfort or pain after the implant surgery is manageable, and even patients who have very complex cases and interventions will report that the pain subsides within a week or two. The healing process and the integration of the implants in the bone, we have a fancy term for that called osseointegration, generally occurs without causing any discomfort whatsoever. It is important to follow the dentist's post-operative instructions, including proper oral hygiene and any prescribed pain management medications to minimize discomfort. We have discussed this at length and provided actionable advice and tips on this topic in episodes number 93 and 94 of the Patient Education series, and I will provide the link to that below. Please note that if pain persists or there is severe pain after the initial healing period, which is uncommon, it is advisable to consult with a dentist or oral surgeon to ensure proper healing and address any potential issues. In the real world, it's important to note that pain tolerance and an individual's experience obviously varies. However, communicating any concerns or discomfort to your dentist will allow them to provide appropriate guidance and support you through the implant process. So in summary and in plain language, if you were to grade pain on a scale of 1 to 10, whereby a score of 1 equates to very little or no pain, and whereby a score of 10 equates to agony, most patients will report a score of 3 on day 1 post-op, a score of 2 on the second day post-op, and a score of 1 on the third day after the procedure. In my practice, we treat a considerable number of Hollywood and television stars, and obviously their facial appearance is paramount to their working life. And so some actionable advice that I always give to these patients in order to create as little disruption to their schedules as possible is to work on Friday morning, have the implant surgery early on Friday afternoon, and take it easy on Saturday and Sunday. And by Monday, they can get back to their regular cinematography workflow. In conclusion, here are some actionable and confidential tricks and tips that we've successfully provided to our patients over the past 3 decades. One of the secrets of managing post-operative pain is to micromanage it. And by this we mean by paying attention to all the small little details which, if they are synchronized, then together they work synergistically, which in pain language means that the combined power of working together is greater than the power achieved by working separately. So by way of example, here is an actionable workflow provided the patient does not have any contraindications or allergies. If a patient is given a medication like diazepam pre-operatively, which is a medication that relieves anxiety and is a muscle relaxant, this will result in you as a patient being in a more peaceful mindset from the outset. And this medication generally lasts 4 to 6 hours. Then, when the surgical placement of the implant is performed, a combination of a shorter acting local anesthetic, for example lidocaine, which is commonly used and lasts about 1 to 2 hours, in conjunction with a long-acting local anesthetic like bupivacaine, which lasts roughly 6 hours, is a smart solution because the patient is totally pain-free for many hours and has the opportunity to arrive back at home from the dental surgery and begin taking the post-operative pain medications way before the local anesthetic has worn off. The result of this is that by the time the local anesthetic has worn off, the oral analgesics have kicked in, and so therefore there's a smooth transition during this process. To micromanage post-operative pain, and once again, provided the patient does not have any contraindications or allergies, a combination of paracetamol, codeine, and ibuprofen work together synergistically and is highly effective. But it is scientifically important that patients take these medications precisely as per the prescribed guidelines, for example, every 6 to 8 hours, because this will ensure that there is the optimal amount of analgesic in their bloodstreams, and the science has shown that it is much easier to manage pain than to suppress it. If you find our content valuable, we encourage you to like and subscribe to help us expand this educational platform. Remember that the path to good health is in evidence-based scientific research. Stay tuned to our next podcast where we will dive into the topic of how long does the dental implant process take and provide you with valuable insights.